Endometrial cancer, a type of uterine cancer, starts within the endometrium, which is the lining of the uterus. Making up 90% of uterine cancers, it's the most common cancer of female reproductive organs and the fourth most frequently diagnosed cancer for women in the United States. Unusual or abnormal bleeding, including bleeding after your postmenopausal, abnormal or discolored vaginal discharge, pelvic pain or pressure, pain during sexual intercourse, or difficulty urinating, can be symptoms of many conditions, including endometrial cancer. These are not all of the possible symptoms of endometrial cancer and can be associated with other conditions. If you experience any of these symptoms, be sure to tell your healthcare provider so they can check them out. Let's take a look at how endometrial cancer is diagnosed. There are no screening tests to check for endometrial cancer in women without symptoms, but if your healthcare provider suspects you may be at risk, there are several tests they can run. To start, your healthcare provider will ask you about your symptoms, determine your risk factors, and discuss your family history with you. Then, they may perform an internal pelvic exam. They'll insert a speculum into your vagina to gently open it. This helps them get a good look at your vagina and cervix to check for any abnormalities, like lumps or changes in the shape of your uterus. Your healthcare provider will also feel your uterus and ovaries. Another test is an endometrial biopsy. During this procedure, a small flexible tube is inserted into the uterus and used to collect a tissue sample from the lining. This tissue will then be analyzed under a microscope to look for abnormal cells. If further tissue is needed for testing, your healthcare provider may order a dilation and curettage, also known as a D&C. Your cervix will be dilated, and a tissue sample will be scraped from the uterus. This is an outpatient procedure typically performed under general or local anesthesia. Another option is a hysteroscopy. This is when a small camera with a light on the end is inserted into the uterus through your cervix. This provides a detailed image of the inside of your uterus. And another testing option is a transvaginal ultrasound, where a wand-like device called a transducer is inserted into the vagina. Sound waves are then bounced off internal tissue and organs to provide a video image of your uterus. Doctors will analyze this image to look for abnormalities in your uterine lining. If a test detects endometrial cancer, you will be referred to a specialist who will further evaluate your condition and assign a stage to the disease. Stage 1 means the cancer is localized to your uterus. Stage 2 means the cancer has spread to the cervix. In Stage 3, the cancer has spread outside of the uterus to close locations. It may have also spread to nearby lymph nodes, the ovaries, and the vagina. Stage 4 means the cancer has spread to your bladder, rectum, or other organs that are further away from your uterus. The good news is that endometrial cancer may be more treatable when found early. There are treatment options available for all stages of the disease, including surgery, radiation, chemotherapy, hormone therapy, and immunotherapy. Your healthcare provider will explain your treatment options based upon the stage of your cancer, and you'll move forward from there. For more information, please visit healthywomen.org.